Dr. Rajashree, ocular granulomatosis, polyangiitis, a case series.
Very good afternoon to one and all. Our study was on the condition ocular granulomatosis with polyangiitis. So granulomatosis with polyangiitis is a life-threatening disease previously called as the vaginous granulomatosis. It belongs to autoimmune multisystem vasculitis affecting the medium and small size vessels. And it belongs to a group of diseases called ANCA-associated vasculitis. The ocular involvement is seen in about 1/3 of the patients, which is approximately 30 to 40%. So this condition has a triad of vasculitis, tissue necrosis, and granulomatous inflammation. So there are a lot of triggering factors like Staph aureus infection, pro-inflammatory cytokines, genetic factors have been studied, which triggers a neutrophil and makes it primed. And in turn, it releases antigens called myeloperoxidase, MPO, and the proteinase 3 antigen. These antigens in turn are recognized by the B cells, and in turn they produce antibodies, which are the ANCA antibodies against these antigens, which in turn gives out a major inflammatory cascade and causes damage to the endothelium, thus causing vasculitis and granuloma formation. So this picture depicts all the systemic features of granulomatosis polyangiitis from top to toe. So our study was to analyze and describe the various ocular manifestations, diagnostic methods, and treatment regimen of GPA. It was a retrospective study done at our center with 14 patients over a period of 14 years. So all patients would undergo a regular ocular examination, routine blood investigations, and ANA and ANCA profile. Wherever needed, if MANTO was positive, we would do a CT chest and ultrasound abdomen to rule out tuberculosis. And if in case of an intracorneal mass, we would do a CT orbit. So out of 14 patients, there was a male preponderance, and the median age of presentation was 46 years. So the most common ocular complaint with which the patient presented to us was redness and eye pain, and the systemic complaint with which they presented was joint pain, hearing loss. And scleritis was the most common presentation which was seen, and next comes peripheral ulcerative keratitis. And in scleritis, necrotizing scleritis was a prominent feature of GPA, and we also had cases of simple episcleritis, which was diagnosed to be a GPA, followed by posterior scleritis, granulomatous panuveitis, optic atrophy, and intracorneal mass. So this is a picture showing necrotizing scleritis on the left, and scleritis with peripheral corneal infiltrates, which will develop into peripheral ulcerative keratitis. So out of 14 patients, 8 patients exclusively presented to us with ocular feature being the primary presenting symptoms. And out of those 8 patients, 6 of them had simultaneous systemic involvement. The lab diagnosis, ESR was found to be really high in these patients, ranging from 50 to 150 millimeter per hour, thus depicting the acute phase reactants like immunoglobulins. And the hallmark presentation of these patients with ANCA antibodies was seen. And there are 2 types of antibodies. It is P-ANCA and C-ANCA, depending upon the immunofluorescent staining. It was called the perinuclear staining or the cytoplasmic staining. So 10 of our patients were positive for C-ANCA, 1 for P-ANCA, and 3 did not have any ANCA positivity, yet we should not rule out vaginous even if ANCA is negative, and it has to be confirmed through biopsy. Biopsy still remains as the gold standard method for diagnosis. Though lung, renal, and orbital biopsy have higher sensitivity, upper airway remains the easiest site for biopsy specimen retrieval. And a study by Maziak et al. Showed that in non-renal biopsies, features of necrosis, vasculitis, and granulomas were most commonly seen. In our patients, we retrieved specimens from lacrimal gland, nasal septum, limbal nodule, intracorneal lesion through orbitotomy, ethmoid sinus, and vitreous. So 5 of our patients had features of granulomatous inflammation, 4 had necrosis, 1 had vasculitis and granulomas, and in 1 patient we also saw positivity of CD20 and CD3, which shows that it has a B cell lineage. So these are slides from our patients. On the left-hand side, we see a giant cell, and on the right-hand side, this is a vessel with the central leukocytoclastic vasculitis. Imaging, we do CT chest for pulmonary involvement, MRI for vasculitis, cerebral vasculitis, and CT orbit for orbital mass. And we'll have to look out for features like nodules, cavitations, and alveolar hemorrhage. And we should be very careful in ruling out tuberculosis because these findings also come in tuberculosis. So the American College of Rheumatology criteria 2017 had given importance for ocular features, but sadly in 2022, when the criteria was updated, the ocular involvement was completely removed. So we followed the 2017 criteria, and we found that 9 out of 14 patients fulfilled the criteria. Treatment, glucocorticoids play the primary role. Along with it, 3 patients were treated with methotrexate, 10 with cyclophosphamide, and 1 with MMF. Though 1 patient who was treated with MMF was ultimately shifted to rituximab, and 1 patient with cyclophosphamide also needed rituximab infusion. So this was post-remission. So the outcome, 7 patients still continue to be on immunosuppressants, 2 patients attained ocular and systemic remissions, and 5 patients have lost follow-up. So take-home points would be GPA is a life-threatening disease with high mortality rate without immunosuppression. A very high ESR value in any type of uveitis should be evaluated in detail, and it is extremely important to rule out infectious disease like tuberculosis. And immunosuppressants and newer biological agents are a game changer, and every ophthalmologist must know the ocular and systemic features of GPA, as early and prompt diagnosis can be life-saving. Thank you.
Do you know why the name was changed?
Yes, ma'am. Actually, Dr. Vagino, he had an involvement. He helped the Nazis in the Second World War. So ultimately, the name was changed to granulomatosis with polyangiitis.
Okay, no other question.